Hello, everybody. I'm waiting for my colleague to get on here so we can go ahead and start. Good afternoon.
Have people that are connected to Sean Foley. Is he like a CSW? Or is he on the?
I think he's a case manager. I'm not 100% sure. I've never spoken to him in person.
He's on it. He's very easy to contact for homeless clients.
Oh, great. I'm glad to hear that.
I don't remember what he looks like. He does come here in person.
I'm not sure. I'm waiting for my colleague. Where's Jewel? Here we go. There's Jewel. We need Whitman so we can get started. Because I got stupid. Come on up, Jewel. I'm tired.
Hey Corey, happy Friday.
Hey, Jewel. Happy Friday. How are you?
I'm good, and yourself?
Yeah. Anything other than that? It's a great day.
I think they cut out a little bit. You said you're tired, but anything other than that, it's a great day?
Yeah.
Cool.
Tired, but that's about it.
Nice. Any plans for the weekend?
Nothing yet. I have a paper that I have to do. But that's about all.
Getting the schoolwork done.
Right. So that's really it. It's only 2 pages, so I can finish it pretty fast.
Nice. It's great to hear. How was your week otherwise?
Not too bad. Not too bad. It's been really good. I'm trying to just float. Okay, here's Whitman. Just making sure I'm floating properly.
Thanks for joining. Welcome, Whitman-Walker.
Yes, welcome, Whitman-Walker. So I guess we'll go ahead and get started. My name is Corey, and I use he, him, his pronouns. Jewel and I are working to bring educational Instagram live spaces for the Whitman-Walker's Community Health Team. During the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to social media platforms. We cover various topics about HIV and STI, sexual health practices, access to care, social determinants of health, and public health interventions. The Community Health Team is here to support and educate you.
Corey, you're a little bit hard to hear. It might be the AirPods if they're on.
Okay. Can you hear me better now?
Way better. Yeah.
Okay, perfect.
Cool. And my name is Jewel, and I use she, hers pronouns, and glad to be here with you all on this Friday.
Yes, definitely. So health disparities and differences in health between different groups of people. LGBTQ plus people experience a number of health disparities. They are at higher risk of certain conditions, have less access to care, and have worse health outcomes. These disparities are seen in the areas of behavioral health, physical health, and access to care. Behavioral health. Behavioral health includes mental health, substance abuse, and addiction. LGBTQ plus people are at a greater risk of suicide and suicidal thoughts, mood disorders and anxiety, eating disorders, alcohol and substance abuse, and tobacco use.
So when it comes to physical health, LGBTQ plus people are at greater risk for certain conditions, diseases, and infections. Gay and bisexual men are more likely to have HIV and AIDS or to experience it. Transgender women and Black and African American women, and Black and African American men and Hispanic and Latino men have the highest risk for new HIV infections. And older LGBTQ plus adults are more likely to rate their health as poor and report more chronic conditions while having less social support. Lesbian and bisexual women are more likely to be obese or heavier. LGBTQ plus people are less likely to have a regular healthcare provider. Lesbian and bisexual women have higher rates of breast cancer, and transgender men and women are at greater risk as well. LGBTQ plus people also have higher risk of HPV infection and related cervical or anal cancers. And, many of these conditions that are, preventable or people can kind of manage if they are able to go to the doctor more regularly, we see affecting LGBTQ plus people because of a lack of LGBTQ plus inclusive care and, poor experiences with health providers who just weren't accepting of LGBTQ communities. And so you're less likely to want to go to the doctor if you're not going to be affirmed and respected and dignified in that healthcare space. There's also the issue of access to care. So LGBTQ people have less access to health care that they need. So they're less likely to have health insurance, are more likely to delay getting care, especially older LGBTQ plus adults. Again, this can be because of the stigma and discrimination they might face when they go to see a healthcare provider. They're more likely to report a lack of cultural competence by their healthcare providers, or their provider just doesn't know the kinds of questions or healthcare needs that are specific to LGBTQ people, and they're more likely to report poor quality of care and unfair treatment by healthcare providers. So again, if you're in a state that is not LGBTQ inclusive and doesn't support or affirm LGBTQ lives, it's not uncommon for you to experience unwelcoming healthcare experiences.
Yes. So what causes these disparities? There are many causes of health disparities faced by LGBTQ plus people. These include the minority status of LGBTQ plus people, a lack of specific education and training for healthcare workers, a lack of clinical research on LGBTQ plus health-related issues, restrictive health benefits, limited role models. So just people just out there to actually kind of model yourself after when it comes to healthcare and disparities. And there's of course a fear due to stigma, discrimination, and institutional bias in the healthcare system. I broke this up. I'll take the next part, Joel, because that was a little bit short. Okay, that's cool. Okay. In order to effectively address LGBTQ health issues, we need to securely, consistently collect information and national surveys and health records. This will allow researchers and policymakers to accurately categorize LGBTQ plus health and disparities. Understanding LGBTQ plus health starts with understanding the history of oppression and discrimination that these communities have faced. For example, in part, because bars and clubs were often the only safe place for LGBTQ plus individuals where we could gather, alcohol abuse has been an ongoing problem. Social determinants of health affecting the health of LGBTQ plus individuals largely relate to oppression and discrimination. Examples include legal discrimination and access to health insurance, employment, housing, marriage, adoption, and retirement benefits. Lack of law protecting against bullying in schools. Lack of social programs targeted to and or appropriate for LGBTQ plus youth, adults, and elders. Shortage of healthcare providers who are knowledgeable and culturally competent in LGBTQ plus health. The physical environment that contributes to healthy LGBTQ plus individuals include safe schools, neighborhoods, and housing, access to recreational facilities and activities, availability for safe meeting places, and access to healthcare.
LGBTQ health requires specific attention from healthcare and public health professionals to address a number of disparities, including the fact that LGBTQ youth are 2 to 3 times more likely to attempt suicide, LGBTQ plus youth are also more likely to be homeless or experience homelessness. Lesbians are less likely to get preventative services for cancer. So this is like regular gynecological or cervical screenings. Gay men are at higher risk of HIV and other STIs, especially among communities of color. Lesbians and bisexual women are more likely to be overweight or obese or heavier set. Transgender individuals have a higher prevalence of HIV and STIs, victimization, mental health issues, and suicide, and are less likely to have health insurance than their heterosexual or LGBT individual counterparts. We also see that elderly LGBT individuals face additional barriers to health because of isolation and a lack of social services and culturally competent providers. And finally, that LGBTQ plus populations have the highest rates of tobacco, alcohol, and other drug use.
So now a little bit about continuing issues in the LGBTQ plus community, um, and LGBTQ plus health. A number of issues we need to continue to be evaluated and addressed over the coming decades, including nationally representative data on LGBTQ plus Americans, prevention of violence and homicide towards the LGBTQ plus community, and especially transgender populations, transgender women of color, resilience in LGBTQ plus communities, LGBTQ plus parenting issues throughout the life course, elder health and well-being, exploration of sexual/gender identity among youth, a need for LGBTQ plus wellness models, and recognition of transgender health needs as medically necessary.
Wonderful. Thank you all for learning a little bit more about LGBTQ health disparities. And one of the, I think, big takeaways for me from this conversation are that it's so important to get regular screenings and testings and preventative care. So I know that not everywhere has accessible and LGBTQ inclusive healthcare systems like Whitman-Walker or, the LA LGBT centers or the Fenway Healths or the, various like Howard Brown Healths of the U.S. But there are smaller clinics to be found in your local states and local cities and whatnot. And I think one of the best things that happened from this COVID-19 pandemic is more access to telehealthcare or telemedicine and electronic healthcare. So even if you can't physically visit a site, you can still always reach out to a healthcare provider and get your healthcare questions answered and possibly set up an appointment. That said, we're living through a pandemic still, and multiple pandemics at this point. So a few reminders about COVID-19 and the vaccines. If you've already gotten your vaccine, congratulations. You've taken a really important step to preventing yourself and your loved ones and your communities from getting sick. Multiple variants have soared across the world, and it's totally understandable if you want to keep wearing your mask. Masks are still welcome, as the vaccine isn't 100% effective at preventing new cases of COVID-19, but it's very effective at keeping you not too sick with COVID if you get it, keeping you out of the hospital from COVID, and making sure that you don't die of COVID-related complications. So please be alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health does have COVID-19 vaccine available. Please call us at 202-207-2480 to make an appointment. And if you're having trouble making an appointment with us, you can, in your DC resident, you can find more information about vaccines at vaccinate.dc.gov or by calling 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. And if you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's super important that you consider getting the vaccine and discuss COVID precautionary measures with those around you, but be mindful of masks and keep your distance, especially when you do not know whether a person has been vaccinated or not. And
Yes.
since we're also living through the the Mpox current outbreaks, important takeaways there are that Mpox is not sexually transmitted. It's not an LGBTQ specific disease. It's not something that is coming from the gay or lesbian or bisexual communities. It is transmitted from close skin to skin contact and droplets and whatnot. So if you're sexually active or if you hug someone, you could get it that way. Currently you can sign up for vaccine appointments, and the vaccine kind of registration website will let you know when there's an appointment available for you based on your need and risk and eligibility, if you will. So feel free to visit your local health department's website to sign up for an appointment, depending on what their vaccine supply is looking like. Finally, please follow us at Whitman-Walker on Instagram, Facebook, and Twitter. At Whitman-Walker, you can visit our website at www.whitman-walker.org to get the latest information on our services and resources. And please follow our family accounts as well at RealTalkDC_ and at NoFilterDC. Thank you all so much and wishing you a wonderful Friday.
Yes, thank you all. Thank you for all the nice comments, shares, likes. This is really important. You guys have a safe and beautiful weekend. Is there a vaccine for mpox? Yes, there is a vaccine. It is the same vaccine that was for smallpox, but they don't have a huge supply of it right now. They are in the process of making more of it. You can sign up for vaccine appointments. They do have those available. And as the vaccine becomes readily available, you will be able to fulfill that vaccine appointment.
Right.
But, yes, everybody have a good day.